A very good day to all of you, my dear children. So today we are going to continue the part 2 of the unit 1 of grade 10 health and physical education. It's about building a healthy society. So in the previous part of our lesson 1, we learned what total health is and about the factors which influence our total health. In this part of the lesson, we are going to learn about the challenges that we face when maintaining total health and how to overcome these challenges. So we are going to talk about a few challenges here, such as the ones given in this slide: economy and level of education, health services and diseases, war and natural disasters, competitive lifestyle and interpersonal relationships, development of technology, influence of the media and the concept of global village, influence of the tourism industry, and about population density. Let's talk how these challenges affect our total health. Let's talk about economy and level of education as a challenge when maintaining total health. As you know, a country's economic status and the education level of its people really influence its overall health. And when you think about it, this directly affects how the country grows economically too. Things like having enough income, eating nutritious food, access to clean drinking water, proper sanitation, living in homes that are spacious and well ventilated, and access to healthcare, all of these are super important for staying healthy. But they depend a lot on both the individual's finances and the country's economy as a whole. So education also plays a big role in health. Take Sri Lanka for example. Even though it's considered a middle income country, we have some really impressive health stats like a very low infant death rate and a high life expectancy compared to some of the other countries. If we talk about health services and diseases, one big reason Sri Lanka has been able to maintain good health standards is the free, high-quality medical services provided by the government. There's an extensive network of hospitals and MOH offices across the country. It makes healthcare accessible to everyone. And then there are programs like the National Immunization Drive, school health services, there are maternity clinics. So along with the amazing work of the public health midwives and the public health inspectors of the government, they have really helped improve people's health. Even small things like ensuring homes are built in a healthy environment. So these are also a part of this effort when it comes to health services. And with the advancements in medical science, we have seen a lot of improvements, such as that the infectious diseases are under control, which is great. But here's the thing: unhealthy eating habits and lack of exercises are becoming a major issue in Sri Lanka, which is leading to more cases of obesity. And with that comes a rise in other non-communicable diseases like diabetes, high blood pressure, heart disease, and strokes. So on top of that, Sri Lanka's elderly population is also growing, which is adding even more pressure on the healthcare system of Sri Lanka. So while there is a lot to be proud of our health sector, there are definitely big challenges coming up right now. And let's talk about war and natural disasters. Luckily, we do not have the war situation anymore in our country, but still we face natural disasters once in a while, especially floods. So it's really challenging to provide health services in places affected by war or natural disasters. So these situations, they can make life really hard, especially for people who have had to leave their homes because of war or natural disasters. So it doesn't just affect their access to health care, but it also impacts their mental health and their overall well-being. And if we talk about the competitive lifestyle and interpersonal relationships, today's education system and the job market are super competitive. And because of that, people hardly get any time to enjoy their life. Leisure time is also very much limited, so it has led to higher stress levels. And on top of that, with everyone being so busy, family bonds and other interpersonal relationships have started to weaken. So these aspects are also affecting one's total health. So let's talk how does the development of technology is affecting our health. We know that technology is a huge help to humanity, especially with all these advancements in the medical field. It has made our daily lives so much easier and very much comfortable. But there's a downside of this. It has also made us a bit lazy because we don't move around as much as we used to do back then. So, because of that, there are many non-communicable diseases on the rise because our lifestyle is not active anymore. So, that's the downside of development of technology on our health. So, another challenge when it comes to maintaining total health is the influence of the media and the concept of global village. The media and internet have a huge impact on our behavior and also on our beliefs. Sometimes the commercial ads, they can have a negative influence on us, especially when it comes to unhealthy food advertisements which target children. So when we spend too much time watching TV, using computers or playing computer games, everything, all these things can harm both our mental health and physical health, whether we are kids or adults. But the media isn't all bad. There's also a good side, as you know. It can raise awareness about diseases, it can raise awareness about unhealthy lifestyle and other harmful practices in society, and it can save people. And thanks to advances in transport, media, and the internet, the world has become a global village now. There are so many advancements in transport. You can travel across countries, and media, you can talk to another person across the world in less than a minute. And the internet is making all this possible. So the world has become a global village. So whether it's a good lifestyle or a bad lifestyle, starting in a certain country across the world, it can spread across the other side of the world in no time. So that is the downside. If it's a bad lifestyle concept, but if it's good, then it's good. So let's see how the tourism industry is influencing our health. So as we know, tourism helps bring countries and people close together. It also generates a lot of foreign income to our country, and that income is helping us to improve the infrastructure facilities in our country. But it also can have some downsides. For example, tourism can lead to environmental pollution. But it's not the case all the time. Some people are very much concerned about the environment than we do as Sri Lankans. However, there's a possibility. And tourism can also create problems like prostitution, which can cause the spread of sexually transmitted diseases, and also it can encourage the circulation of drugs, legal drugs, and even harm the local cultures. So there's both good and bad. We're talking about the bad side as a challenge to our total health. And the last point that we're going to talk under challenges of maintaining total health is population density. So population density refers to the number of people living in a certain area of land. So as the population density increases, we have seen more common health issues, especially those related to the respiratory system, the digestive system, and higher levels of stress. So there are many actions that can be taken to overcome these challenges faced when achieving total health. One such overcoming mechanism is improving the education level of the population, like making health education a compulsory part of schooling so that everybody gets an understanding about all these things. And also we can strengthen the prevention and treatment sides of our healthcare system. Not only it's about treating the patients, but also preventing people from becoming patients anymore. And also we can identify problems that come from our busy and competitive lifestyle, the technology, the media influence, and this concept of global village. We need to raise an awareness about these issues among people and how to tackle them. We can also improve the economic situation of people, like it's the responsibility of the government actually, and also addressing the health effects of increasing population density, like adding more staff to the healthcare system, to the hospitals, or introducing housing projects with proper sanitation and not allowing urban slums and all, organizing awareness programs for school children and for communities, especially in the tourist areas, and teaching them about potential health and social issues that they might face because of the tourism industry and preparing solutions for them. And when it comes to war and natural disasters, we can focus on improving the welfare of displaced people, of people who have lost their houses. And the government needs to focus on creating policies that support total health for everyone. So when we summarize the lesson that we learned today, we talked about challenges to maintaining total health and actions that can be taken to overcome these challenges. So here we complete our first lesson, and please stay tuned for more lessons. Thank you and goodbye.